Hello and welcome. Let's talk about aspirin. So, what is aspirin? Aspirin is an OTC drug which is used throughout the world as antiplatelet drug. It is a non-selective blocker which blocks both COX-1 and COX-2, and this is the only drug which irreversibly blocks cyclooxygenase. Now, chemistry is that it is a acetyl salicylic acid with weak organic acid properties. Now, pharmacokinetics. The salicylates are rapidly absorbed from GIT. The aspirin is prodrug and is rapidly hydrolyzed to acetic acid and salicylate by steroids. The plasma half-life is 3 to 5 hours. It is highly bound to albumin. It is highly metabolized to salicylate. It is excreted by kidney, and the alkalinization of the urine significantly increases excretion. Now, pharmacological effects. First is anti-inflammatory effect. The aspirin irreversibly blocks cyclooxygenase, which leads to decreased production of the prostaglandins and thromboxanes, leading to decreased inflammation. It also interferes with the chemical mediators of the kallikrein system and inhibits granulocyte adherence to damaged vasculature, stabilizes lysosomes, and inhibits chemotaxis of neutrophils and macrophages and leads to decrease in the inflammation. Analgesic effect. It mostly decreases mild to moderate pain, and it decreases musculoskeletal pain of somatic origin. It is generally effective in pain with inflammation and tissue damage. It decreases pain by peripheral action mostly and also by central action. Now, aspirin on peripherally, the prostaglandin E2 and prostaglandin F are thought to sensitize the peripheral pain receptors and nerve endings to the action of the bradykinin, histamine, and other chemical mediators released locally by inflammatory process and responsible for pain. Aspirin and other NSAID inhibit prostaglandin synthesis and thereby decrease the pain and pain threshold. Centrally, it probably inhibits the pain stimuli at the subcortical region of the spinal cord. Now, antipyretic effect. The normal body temperature is not affected. Now, the antipyretic effects of aspirin. NSAID inhibits COX in the CNS, and there is decreased prostaglandin synthesis, and there is decreased interleukin-1 synthesis. It resets the thermoregulatory center, and there is dilatation of the superficial blood vessels causing sweating, and there is decrease in the body temperature leading to decreased fever. Now, antiplatelet effect. The low dose aspirin is used as antiplatelet drug. The platelet releases thromboxane A2, which leads to platelet aggregation and vasoconstriction and leading to formation of the thrombus. The endothelial cells of the blood vessels release prostacyclin PGI2 and decreases platelet aggregation and vasodilatation, so there is no thrombus due to prostacyclin I2. Now, aspirin in high dose can inhibit prostaglandin I2 in vascular endothelium, but the endothelial cells are nucleated and can regenerate COX enzyme. Aspirin in low dose, about 80 to 100 mg per day, irreversibly blocks COX enzyme in the platelet and decreases thromboxane synthesis and decreases the platelet aggregation up to 8 to 10 days because platelets are non-nucleated and cannot regenerate the enzyme, and there is no thrombus formation. The bleeding time increases, so aspirin should be stopped 7 days before surgery. Now, effects on respiration. In therapeutic dose, it causes uncoupling of the oxidative phosphorylation, leading to increased oxygen consumption and increased carbon dioxide production, and there is increased alveolar ventilation and respiratory alkalosis. Aspirin in high doses may depress medullary center, and there is uncompensated respiratory acidosis followed by metabolic acidosis. On GIT, the prostacyclin PGI2 decreases gastric acid secretion. Prostaglandin E2 and F2 alpha stimulates protective mucus both in the stomach and small intestine. The aspirin inhibits prostaglandin synthesis, so there is increased HCl secretion and reduced mucus secretion leading to peptic ulcer. So aspirin can be trapped inside the cell and directly erodes the mucous membrane. Now, renal effects. Prostaglandin E2 and prostaglandin I2 are responsible for maintenance of the renal blood flow in presence of the vasoconstrictors angiotensin 2, catecholamine, and vasopressin. The aspirin decreases prostaglandin E2 and I2, and there is reduced renal blood flow, reduced glomerular filtration rate, and there is salt and water retention. Now, effect on uric acid. The low to moderate dose of the aspirin causes decrease in the tubular secretion, and there is decreased excretion of the uric acid, leading to increased serum uric acid level and hyperuricemia. The high dose of the aspirin leads to decrease in the tubular reabsorption and there is increased uric acid excretion, and there is decreased serum uric acid level, and there is uricosuria. Now, on CNS, on higher doses, it leads to vomiting, tinnitus, decreased hearing, and vertigo. Now, in case of the acid-base and electrolyte balance, there is dose-dependent effect. On high therapeutic doses, there is compensated respiratory alkalosis. On toxic doses, there is metabolic acidosis and hypothermia. Now, clinical uses. It is used for the mild to moderate type of pain as a frequently used analgesic. For headache, myalgia, arthralgia, rheumatoid arthritis, it is a drug of choice. Rheumatic fever, gout, and dysmenorrhea. For inflammatory conditions like arthritis, pericarditis, osteoarthritis, mild SLE, rheumatoid arthritis, rheumatic fever, myositis, tendinitis, synovitis, psoriatic arthritis, Reiter syndrome, and ankylosing spondylitis. For fever, it is also used as antipyretic. It should not be given in children. It may lead to Reiter syndrome in children. As antiplatelet agent to decrease incidence of the unstable angina. For coronary artery thrombosis, myocardial infarction, transient ischemic attack, thrombosis, and after coronary artery bypass. As keratolytic agent for fungal infection, aspirin is used with benzoic acid to remove gland to decrease incidence of the carcinoma of colon, for decreasing the risk of Alzheimer's disease and radiation-induced diarrhea. Now, adverse effects. The commonest effects include nausea, dyspepsia, heartburn, vomiting, gastric upset, erosive with aesthetics, gastric bleeding, gastric and duodenal ulcer. There may be gastric bleeding, and the drugs used to decrease NSAID-induced gastric damage are misoprostol. It may lead to hypersensitivity reaction, which is the second most common. Rashes, urticaria, allergic rhinitis, bronchial asthma, photosensitivity, nasal polyp, erythema multiforme, toxic epidermal necrolysis may be seen. It may lead to bronchoconstriction with exacerbation of bronchial asthma. On CNS, the higher dose leads to tinnitus, decreased hearing, vomiting, and vertigo. On toxic dose, there is metabolic acidosis, respiratory depression, cardiotoxicity, glucose intolerance. On higher doses, there may be hyperpnea. On renal effects includes arterial hypertension and irreversible renal damage, chronic interstitial nephritis, renal papillary necrosis, and acute renal failure. It may lead to hepatotoxicity and cholestasis and hypoprothrombemia. It may lead to hypouricemia and gout, thrombocytopenia, neutropenia, hemolytic anemia, red cell aplasia, hyperpyresia, and Reye's syndrome, leading to encephalopathy. Now, treatment of aspirin toxicity. Gastric lavage with charcoal can be done. Dehydration should be corrected. Hyperpyrexia should be corrected with ice pack. Electrolyte imbalance should be corrected with hypoglycemia and 5% dextrose potassium. Alkalinization of the urine by sodium bicarbonate and correction of the acid-base balance, and ventilatory assistance if needed. Now, drug interaction. If aspirin is given with ethanol, it increases GIT bleeding. Warfarin displaces warfarin from the plasma protein binding site, leading to increase in the warfarin toxicity and bleeding. Sulfonylureas, it increases toxicity, and ACE inhibitors, loop diuretics, and beta blockers decreases activity. Now, comparison of other NSAID with aspirin. Analgesia, ketorolac is good, and then ibuprofen, then naproxen, and aspirin. For gastrointestinal irritation, it is seen more in aspirin. For allergy, aspirin is more common. For renal toxicity, nephritis, nephrotic syndrome, acute renal failure are more seen. End of the topic.